therapies. And it will probably sound very similar to a lot of your other patients because my story and my struggle is frankly not unique. So I have complex regional pain syndrome type 2. I'm gonna have a lot of notes here because I needed some help actually with the medical discussion here because I'm obviously not a doctor. But it was caused by a sports injury that resulted in a Schatzker-5 tibial plateau fracture. And that caused anterior and posterior compartment syndrome that was untreated for almost 48 hours. I spent 2 weeks with drains in my legs before I could be stabilized enough to actually fix the fracture. I had an external fixator, and there were 4 surgeries over a period of 3 weeks, multiple blood transfusions. I did almost die. It was a very challenging time for my family who love and support me through all of this, and they're also doctors, and so we're incredibly frustrated by the situation and by the fact that I was found in that situation. So I had anterior and posterior tibial syndromes and developed foot drop as a result of that. Permanent and substantial damage to all of the peripheral nerves below the knee in my left leg. So this is, you can see, I'm very happy to walk all of you through all of the different surgical procedures. You know, that gets to more of like an intellectual discussion than it actually does, you know, the more painful memories. I ended up with, we'll get into the more painful stuff here now. I had severe muscle atrophy and nerve death in 3/4 of the soft tissue below my knee. And MRI actually showed complete severance of the main branches off the common peroneal nerve below my knee. And in order to work with the foot drop and get me to a point where, as you can see, I can actually walk around on it fairly proficiently now. I'm still disabled, but substantially less. There was a couple of surgeries that were staged over a couple of months. The last working tendon in my lower leg was actually transferred to the top of the foot to correct the foot drop. And you know, prior to that, there was a calcaneal osteotomy and a couple of other things to actually correct the damage from walking with foot drop, because I was walking around New York City for almost a year like this. I spent, after those surgeries, and you know, during the 2 months of the surgeries and 6 months post, I had 8 months non-weight bearing, and that caused bone density loss and osteoporosis in the affected leg. And I think you know what's coming next. A rainy night in New York City, and I slip and fall right onto that bad knee, and end up with a distal femur fracture. And another week in the hospital, stabilizing for surgery, more blood transfusions. These were not good times. 2 more months on crutches afterwards, after fixing the fracture, and my leg pretty much looked like a twig. It was pretty awful. Due to the denervation that I had below my leg, we're going to switch over from the osteoporotic stuff and move on to some of the other things. I had wound care problems where a blister on my big toe, this is where I learned to be very careful about my shoes. A blister on my big toe did not heal for over 8 months. And I was basically at risk of infection and amputation at pretty much any time. I ended up with autonomic thermoregulatory disorder, where this foot could be 2 to 3 degrees centigrade different than my other foot when you were actually measuring it. Of course, in order to go through diagnostics on a lot of this stuff, I had, you know, lots of EMGs and nerve conduction studies as well. And when they took the initial ones before the tendon transfer, but after the initial injury, there was no response in the muscles in the peroneal and posterior tibial and anterior tibial nerves. Eventually, I got enough growth, regrowth in my leg to actually be able to walk on my own. which is amazing and fantastic. And no running, no bicycling, no dancing, no any of the other things that you would want to do in your 20s. But I can walk again, and I can do so without a walker, without crutches, without canes, which I used assistive devices for almost 6 years, 7 years, to be able to combat the actual physical disability that was caused. But in terms of pain management, it was honestly barely adequate. And we threw everything at it. My pain management doctors were really on my side and trying desperately to find solutions to be able to deal with this. And honestly, the answers at that time were not very good. There were 11 different daily medications that I was on, including OxyContin, Dilaudid, Tizanidine, Cymbalta, Lyrica, Vyvanse, Colace, Senokot, for obvious reasons. These didn't really work very well for the neuropathic pain that I was dealing with. And honestly, my life was barely livable. It was very, very difficult. I dealt with exhaustion, fogginess, the inability to focus, of course constipation, kind of already covered that. Difficulty with complying with the medical regimen, because I was having to take medications 4 to 5 times a day. It was impossible to work. I couldn't do normal 20-something things. I mean, my initial injury was actually when I was 23, and living in New York City, working in a prestigious law firm, and pretty much unable to do anything that my friends were doing. I had horrible insomnia, not just from the pain, but also as a side effect of the medication. Not to mention that several of those medications cause substantial weight gain. And they say may cause, but everyone I have talked to who has used those medications has ended up with weight gain. Mine was fairly extreme because obviously I had no way to work off that weight. And in addition to that, that of course is going to cause additional pain management issues, and then not to mention the joint discomfort that ends up from having too much weight for your frame. So what kind of life was I supposed to have based on just the medications? This is external to the pain. They didn't work very well for this condition. They worked for other conditions. Of course, I had arthritic pain as well, and certain of those pain management tools are excellent for that. Neuromuscular pain, musculoskeletal actually is what I should call that. But the neuropathic pain was really undermanaged, and not at the fault of my physicians in any way, but due to the fact that I was really desperate to have a normal life, and couldn't do so by using a lot of these medications. So I was able to do what I had to get to a point where I could focus on my work, be able to go back to school to get my JD MBA, and got it down to actually 2 maintenance medications. And I'm pretty proud of that. It took about 7 years to do so, but I got it down to just gabapentin and Lexapro. Those are my current normal medical regimen in addition to cannabis. But I tried other things. I tried lifestyle changes. I was absolutely religious about my physical therapy, which I do think did help quite a bit with the pain management, as well as getting back to the ability to walk. I mean, I cannot speak highly enough about physical therapy as something important to include in pain management as well. But of course, there's constant doctor visits. I use TINS units to try to shock it to normal. Acupuncture, of course. And at one point I was, actually at several points, I was even considering amputation. Except, of course, as you all know, that does not work for this type of pain, and in fact can cause it to migrate up. So that very quickly put the kibosh on that, probably for the better anyways. But I also did have surgical nerve releases done. We considered 3, but I went ahead with 2. The first one was very effective in doing some release. That was done actually back here. And helped relieve some of that nasty burning sensation that I had on the top of my foot. I still have pain there, but it's not that really horrific burning bees stinging pain. And then the second one was unsuccessful. It was back here for this nerve entrapment back here, and that one unfortunately was not as effective, and so we decided not to do the third one, as it had an even less likelihood of success. But as you can see, I was truly desperate to find anything that would work, and anything that would help me decrease my drug regimen in order to maintain a normal life, but also be able to focus, but have enough impact on the pain that I was able to function. Because this is a delicate balance that the patients go through, of course. And then, you know, I moved out to California, and my father, who's a neurologist, actually called me up and said, Ashley, you're in a place where you can access cannabis. Why aren't you trying it? There's meta-analysis that's been done that actually very strongly supports the effectiveness for neuropathic pains. And you're in a place where you have fairly easy access to it. And, you know, I thought to myself, you know, I've tried just about everything else. What harm could this do? It's, you know, it's something that a lot of people have been using for thousands of years. It was just, you know, I was concerned again about my ability to function in a really stressful and difficult job as a financial institution lawyer. So I looked into it a little bit further and said, okay, well, I'm going to give this a try. Blocked off a Saturday so that it wouldn't have any impact on my work, and tried an edible. And this was again, pre-CBD craze, so you know, I was trying regular whole flower. And for the first time in 11 years, I was actually pain-free. I'd like to let that sink in for a second, because I have CRPS type 2, and I was pain-free. That's incredible. It's something that doesn't happen. Well, not in the medical literature, it doesn't. So this is a plant that's amazing for neuropathic pain. We know that it helps with people undergoing cancer treatment, that it helps with the pain that is derived from the treatment that they go through. We know that it's effective actually for other types of neuropathic pain, not just CRPS type 2. This is information that's actually been available for thousands of years, that this is good for pain management, but we have had stigmas associated with it, understandable stigmas. But I'm here to sort of try to put some of that stigma to rest, because one of the things that was incredible about this is also how long-lasting it was. I dosed once and remained pain-free for 24 hours without redosing. That's longer than any of the other medications I'm on, including that entire list where I was having to dose 4 times a day. So I have actually gotten to a point where I use once a day. I use it right before going to bed. It works for my neuropathic pain, and it lets me sleep, which is just, it's another part of the cycle of pain, is the fact that you can't sleep from the pain management protocols. All of these things are very positive and very strong in favor of the case for using cannabis. So I would like to, at this moment, point out that my experience is actually fairly common. We have lots and lots of anecdotal evidence from other patients that discuss how cannabis actually ended up impacting their life and their pain management regimen in such a positive way, that we do also know that this is not placebo effect. There are thousands of people. We have fairly reasonable normalized data that actually proves that this is not in the patient's head, that this is having an impact for them. So now that we've kind of covered my story and how I came to cannabis and why I feel so strongly about talking about this to this particular community as another tool to help in long-term pain management. I'd like to talk a little bit about the challenges, actually, of becoming a cannabis patient. Getting access to cannabis is difficult. I voted with my feet and moved to a place where I had access. I have lived in New York, Chicago, Atlanta, DC, Connecticut, and at the time that I was going through these things, medical cannabis really it wasn't even being talked about. It certainly wasn't accessible, and gaining access to it through professional recommendations, through doctor recommendations, was just utter nonsense. You were not going to be able to get that. Now, times have changed, luckily. A decade later, we actually have clinics. There are clinics that are focused on being able to evaluate people for cannabis use. There's literature that's coming out. There are studies that are very promising. There's new research even being done in the United States, which is very promising. And this discussion amongst the states, amongst the many states, to give access to this to patients as well as to adults in a more lenient fashion who may feel that they need it, has become much better. But there are still challenges, and particularly in the states that only have medical access. So, one, you need a doctor's recommendation. You also have to get a medical card. These are generally not done at the same place. You pay for both of those. That gets to be very expensive. It's certainly not covered by your formulary. Locating the dispensaries is challenging next, because most dispensaries are not allowed to advertise in a way that is normal. I mean, it's not like a CVS or a Walgreens where they're going to be telling you that they have free flu shots, based on your insurance, of course. And so you have to have specialized tools to actually help you locate a dispensary. That information's not that accessible. And then getting there is a huge challenge. I talked to you a little bit about my own ambulatory difficulties. And this is something that actually affects a lot of pain patients. Many pain patients have difficulty with movement. Sometimes it's the cause, sometimes it's an after effect. But these are challenges that a lot of pain patients have. And frankly, most of these dispensaries are not located anywhere